down and we created some more programs. And this one is on stress and depression and brain health. This is a really big topic right now. There's so much information out there about stress and depression. I wonder why. It couldn't be the last year that we have all just lived through, could it? Because we're going to talk specifically today, as I've been putting this program together over the last few days. Some of these numbers, some of the things that are out there, I think are going to surprise you, even if you've worked in the field for a very long time. So we're going to go ahead and get started. Again, you will get a copy of these slides. This may be a little bit hard to see, but when you get it, you'll be able to see it a little bit easier. So we know that stress is just a common part of our daily life. It comes up each and every day in a variety of forms. It might be stress from our commitments. It might be stress from our family or our work or our church or our friends. It might involve stress because of money. That's a huge stressor. Our health, the health of a loved one, or it may be a stress over our relationship. But no matter where the stress comes from, our body either senses a real or a perceived threat and it goes into action. It's supposed to do. So what happens whenever we perceive threat? We dump cortisol in our brain and adrenaline, and we go into what's called a fight, flight, freeze, or fawn. Now that may be one that you haven't heard of. We tend to hear the fight, flight, freeze, but there's also that fourth one called fawn. And this is what some people do whenever we get in that real high level of stress. We go into people-pleasing mode. We try to please to avoid conflict, and that's what that fawn is. So we go into fight, flight, freeze, or fawn because our body and mind's trying to deal with whatever is happening and whatever's causing our response. So let's look at this picture here and just look up there at what stress does to the head. And you're going to see some familiar things: mood, anger, depression, irritability, sadness, lack of energy, swings in appetite, concentration problems. These are all when we get to depression. This is going to sound really familiar. Sleeping issues, headaches, pain, mental health issues, anxiety disorders, and panic attacks. And that's just what stress does to our head. And then you can look there on down the body: skin, joints, muscles, heart, stomach, pancreas, intestines, reproductive system, and immune system. Now, one of the things I do want to point out, and this is really common, and so many times we don't put this together, is how stress affects our intestinal. Irritable bowel syndrome is very, very common whenever we are under a tremendous amount of stress, because when we have that initial cortisol dump, it halts our digestive system. So please keep that in mind. Many times people don't put those two together. So what's going on with stress in the brain? That brain is going through some reactions. Some of them are good, some of them are bad, and it's there for a reason. It's there to help protect us from these threats. Now, stress can be a good thing because it can sharpen our mind. It improves our ability to remember details. Lots of times that's why we do remember some, but it can also contribute to mental illness. And it's actually time, and we're going to talk more about that whenever we are under what's called chronic stress. So how does chronic stress relate to mental illness? Chronic stress is defined as a prolonged and constant feeling of stress. This is not situational stress. This is not something that just happens and then it's gone. This is a very prolonged time, and it makes us more prone to mood and anxiety disorders. So one of the things, that second bullet point, chronic stress plays a role in the development of depression and other emotional disorders. That's why we put these two together, the stress and the depression, because many times people will use that word stress, but they won't use the word depression. There's the stigma attached to it that we've got to start getting past this. On that third bullet point, this is what they found in research. This is kind of the science behind it. They found that stress, when we're under a tremendous amount of stress, it creates more myelin producing cells, but fewer neurons than normal. So that starts interfering with the timing of our communication. And then it has these negative effects on our hippocampus. So what is that myelin? It's actually a substance that it surrounds our nerve cells and it insulates them. And it helps increase the rate that the impulses are passed to one another so that we have our impulse control, basically. And then our hippocampus, of course, that helps control where we convert short-term information into long-term information. And it also plays a big role in our spatial memory. This would explain why when we are under a lot of stress, we have a hard time doing that, taking these something that happened today and putting them into long-term. It's like we just forget them. Where is it? Where did it go? That's due to stress. So many times as caregivers, people will say, I think I'm catching the dementia. We're not catching dementia. You can't catch it. It's not contagious. We're under a tremendous amount of stress and our hippocampus isn't working properly. Stress changes the structure of the brain. Those who have suffered from PTSD, those who have suffered from chronic stress for long periods of time actually have changes in the gray and the white matter in the brain as they've studied this. So what is that gray matter for? That gray matter, whenever we're looking at these scans, that's the neurons and that's the cells responsible for that higher order thinking, such as our decision making and our problem solving. So that's what the gray matter is. And then the white matter, that's what communicates the information from one region of the brain to the other. Now, there's this psychologist that I was reading about yesterday, and she suggests that only bad stress impacts the brain in this way, that the brain knows the difference in bad stress and good stress, and that good stress, which is the type that helps us perform well in the face of a challenge, that helps in a positive way, and that actually helps us with resilience. Think about if we were getting ready to go out and speak before a large crowd of people, do a program like this. Some of you are going, oh, I would never want to do that. So that creates some stress. That stress can actually be a good thing and help us be on point and help us make sure we hit all of our talking points. Athletes talk about using stress to help kind of push them forward and do their best. So there is this difference in good stress and bad stress. So with the bad stress, our brain can become very vulnerable. And with that good stress, it can become very resilient. Now, this was another thing I found that I thought was really interesting. And we have got to understand this and make people more comfortable talking about it, that stress kills brain cells. So they found in a study that a 20-minute stressful situation actually killed neurons in the hippocampus. They concluded that stress didn't impact the ability to create the new neurons. You could still create the neurons, but it impacted the ability of those neurons to continue to survive. And then this Dr. Peterson came in and concluded that when one starts an antidepressant, that may help keep those vulnerable new neurons alive. So when we get to that point where we're arguing or we're having to make that decision, should I do antidepressants? Because so many times people don't want to talk about it or they don't want to go on antidepressants. Right here's this is pretty convincing. If an antidepressant can keep those neurons from dying, it keeps them alive because they're vulnerable. I think this is really something to consider and look into. Now, here's what I was talking about stress shrinking the brain. Even among healthy people, stress can lead to shrinkage in areas of the brain associated with the regulation of emotions, metabolism, self-control, and memory. They concluded that it is the chronic everyday stress that is intense and traumatic that contributes to this change, not sudden intense stress. So that sudden intense stress, we many times call that situational stress. That can be a natural disaster, a car accident. It can even be the death of a loved one because it is sudden, but it tends to have a beginning and it has an ending. This is talking about chronic stress over a long period of time. It has a snowball effect. And then when that next event happens and we need to pull from our reserves, we don't have any reserves because we have this frailty in our emotions. The other thing, stress is destructive to our memories. Like I said earlier, where are my keys? Where are my glasses? And they're on my head. Where's my car? If you've done that before and you come out going, oh no, what is happening with my memory? Stop and think about how much stress are you experiencing? Has it become a way of life? Has this become your normal? So that chronic stress, again, it plays into our spatial memory, and our spatial memory is what helps us recall the location of objects in the environment. So that explains why you lose your car and why you lose your keys. That's that high level of cortisol that's being dumped, and high levels of cortisol is connected to short-term memory loss. The timing of stress comes into play as well, because memory can be enhanced by stress. If you've ever had something happen and when you think back on it, you can remember every detail about it like it's in slow motion. You can see it, you can smell it, you can taste it. That's where stress actually comes into play and can be a good thing. Now, memory retrieval is often impeded in those who have undergone a tremendous amount of stress as a child, and you've heard this term, repressed memories. When a child undergoes stress that their brain is just not able to handle, they will repress those memories, and it does come out later. It comes back. So kind of a summary of stress before we move over into depression, and they kind of roll together. It's just the body's way of responding to a situation. We can have symptoms like a pounding heart, sweating, tense muscles, fatigue, and number one, irritability or anger in a lot of people. The Alzheimer's Society has found a link between those with PTSD and long-term stress and then developing dementia later in life. And we're going to talk about depression and developing dementia later in life. Here's another study that was done in Denmark that found that 1 out of 5 people who had decades of stress, that's the chronic stress in their lives, later developed dementia because it changed the brain chemistry. And so prevention for stress, things that we can do. These are things that we know, but are you doing them? We know to do this. Eat those healthy foods, get that exercise, have productive sleep, staying social, doing things to challenge our brain, not sitting in front of the TV. It takes some effort, but it takes 28 days to make or break a habit. We can do anything for a little while. We most definitely can. So 60% of caregivers on a poll done by caregiver.org reported depression at some point during their journey of taking care of somebody with dementia. 60% reported. I am going to say that's low, that we had some people that either weren't honest or they weren't calling it what it really was. So switching over to depression, and we're going to tie them together here at the end. What is depression? And do you realize that you can be depressed and not feel sad? Just like you can have a dementia diagnosis and not have memory loss at the beginning. So when you think of depression, what comes to mind? And did you realize that there are over 20 symptoms? Here are 10 faces of depression. Some of these you may have known, you may have heard their stories, and some of them you may not have known this. 4 of those aren't with us any longer. Now, these folks all have creative outlets that they use. And you may recognize there, for those of you that don't, we've got Robin Williams, that's Philip Seymour Hoffman, Chris Farley. Bruce Springsteen has very recently written a book about his lifelong struggle with depression. He has an outlet with his music. There's The Rock, Dwayne Johnson. He talks about his depression. Brooke Shields was one of the first people to come out and talk about postpartum depression. Lady Gaga has been very vocal. Katy Perry, that's Mandisa. She's a Christian singer who has done an entire album about a period of about a year that she went through a really deep depression. And of course, Marilyn Monroe is on there as well. These are some of the signs and symptoms of depression, and depression affects different people in different ways. Right now in the United States, we are all living through something that's called collective grief. Whether we're calling it that or not, we are all in a state of collective grief because together we are grieving what was. We're still in this messy middle. We're not to the new normal. And this is grief that we're in right now. And part of grief is depression, whether we like that or not. It's part of it. So you may not necessarily be having that sadness, but are you having any of these other things on this list? That difficulty in thinking, anger, irritability. The easiest emotion is anger. But if you get down to the root of anger, 9 times out of 10, it's fear. And this past year, we had a lot of things that we were afraid of. And we saw a lot of anger. We're still seeing a lot of anger. And when we get down to the root of anger, it's almost always fear. And we've got to be able to call it what it is to be able to get on top of it. That's kind of therapy 101. If you can name it, you can tame it. If you can say it, you've got power over it. If you can write it down, you can get control of it. So what does depression look like in older adults? And by older adults, this is from the Mayo Clinic. This is 65 and older. Notice that it says it is not a normal part of growing older, just like memory loss is not a normal part of growing older. Slowing down is, but not memory loss and not depression. It'll go undiagnosed. They're reluctant to seek help. And they may look a little bit different. It may show up as some memory difficulties. That's why we've got to get to our doctor and get a complete and thorough checkup with our older adults, because depression can be treated. We're going to see depression can be treated 80 to 100% of the time. It can be completely cured. But this is how it can show up in older adults. Now let's look at the most common types of depression. These are the 5 most common types of depression. I did leave bipolar disorder off of this. That's part of it, but these are the 5 most common types of depression. This is a chronic depressive disorder. This is a depression that lasts for a minimum of 2 years, and major depression comes in bouts with periods of less severe symptoms. It's almost like it'll flare. We'll have periods of major depression, and then we're kind of on this plateau, and then we'll have another period of major depression. Postpartum depression is one of the most common types of depression that we hear. Seasonal affective disorder. Seasonal affective disorder can happen in any season, but most common, we usually see it in the fall and the winter where there's less natural sunlight. Typically, people will start to withdraw, they increase sleep, they may gain weight, and it can return year after year. They make lights for this. I have one sitting here on my desk called a happy light, and it mimics sunlight. So that's one of the things you can do for that. And then there's major depressive disorder, and this is clinical depression. And this is symptoms that last most of the day. It has to last for 2 weeks, and it has to be symptoms, all of those symptoms you saw earlier. And again, it's going to look different in different people. It's affecting our work, our sleep, our study time, our habits, our eating. And most people will have at least 1 episode during a lifetime. Most are going to have at least 1 episode during a lifetime, if not multiple. And then there's situational depression, just like there's situational stress. where we may be feeling sad or low because of a situation. Maybe we lost a job, we've gone through a divorce, we've had a breakup. It could be the death of a loved one, and it is situational depression. It's directly related to an event. And this is where that grief comes in waves. And if you've ever lost somebody, again, been through a divorce, been through a natural disaster, where you're going along, you seem to be okay, and it's like a wave overtakes you, most of the time that is a situational depression, because our self-esteem tends to stay intact during that time. But grief and depression can absolutely coexist. So how do we get diagnosed for depression? We want to, if we've had these symptoms for 2 weeks, we can go to our primary care physicians, typically where we want to start, and have a thorough exam to make sure that it isn't something else that's going on. Doing some lab work to make sure that this isn't a thyroid problem, because this can also mimic vitamin deficiency, malnutrition can mimic as well. And then looking at the medical and family histories, we can go to a psychiatrist. They specialize in mental health. They can perform therapy. Typically what they do is they will do medications, and then they will recommend a therapist. And there are licensed professional counselors. There are licensed clinical social workers. There are some LMSWs, licensed master social workers, who also do some counseling or therapy. Licensed professional counselors can do depression inventories, and then do some different types of therapies that we're going to talk about. And then a psychologist can also do an in-depth psychological testing. So treatment for depression, and I said this earlier, 80 to 90%, and actually that should say 100, 80 to 100% can be cured. And then that additional 10 to 20% will see a reduction in symptoms. So at 100% of the time, we can get better. That's what we've got to understand about depression, because when we are deep, deep in a depression, it doesn't feel like we're going to get better. I am talking from experience. It doesn't feel like it is ever going to get better, but it does, and it can. The earlier the treatment begins, the more effective it's going to be. And again, no two people are going to be affected the same way by depression. And there is no one size fits all. And if you have had, let's say you had some depression in your 20s, and you took a particular antidepressant, and you have a depression again in your 50s, it doesn't mean that that antidepressant is going to be the one that works for you this time. So speaking of antidepressants, they are not habit forming. They are not uppers. It does take 2 to 4 weeks, sometimes longer than that, to get the full effect. It can take up to 2 to 3 months. However, you may start seeing some symptoms improve before you feel that depression lift. So sleep may change, appetite may change, concentration may change, and that's the antidepressant working. They are usually recommended for at least 6 months whenever somebody starts them, and we don't ever want to stop them without help of the doctor so that we don't go through withdrawal symptoms. Then there's also talk therapy, counseling, psychotherapy. Typically, cognitive behavior therapy is where people will start. There are lots of different types of therapy, but this focuses on problem solving and reframing what is going on with us. Interpersonal therapy is more of a short-term therapy that's 12 to 16 weeks. And then there's a problem solving therapy that helps us get in and look specifically at day-to-day life and problem solving. And I'm hurrying because I want to leave some time here at the end. So let me quickly get through the rest of these. Other interventions for depression, exercise is going to be, again, whenever we're in the middle of a depression, that's the last thing we want to hear or want to do, but it's one of the best things that we can do. And if we will commit to a gradual goal, not an immediate goal, but if we can commit to, I always ask people 10 minutes a day, can you do something for 10 minutes a day? And you start to feel a little bit better. Can we do it for 20? And we work ourselves up and we start to feel better. How do we help other people who are depressed? Making sure that we are, if we could be just that listening ear, most of the time they don't need you to fix it, and you don't know how to fix it, and they don't know how to have you fix it. They just need somebody to listen to them. Don't ever ignore comments about suicide. If they say something about suicide or not wanting to live, help them adhere to a treatment plan. be there, be present, and remind them that time and treatment, that depression will lift. Now, I do want to talk about the link between depression and dementia. Untreated, that's the key word. Untreated depression can lead to dementia. They are showing this. There are reports that have been done. There are studies that have been done that are showing that untreated depression changes the chemicals in the brain permanently. And so we are seeing people who are ending up with dementia after the age of, typically it's after the age of 60, who have had depression. Recurrent depression over the course of one's life that's not treated has become linked to vascular dementia. Anxiety and depression damage the brain because of the chemical changes that occur in the hippocampus, and that is our memory center. Another area that can be damaged by depression is that conflict resolution center, and that's associated with our planning and our executive function. So we've got to treat depression. So places that we can go for help, I've put some information on here. There's going to be a couple of slides. National Institute of Mental Health, Behavioral Health Treatment Service Center, your PCP office. Psychology Today is a great place to go and look for a therapist, teletherapy, psychiatrist. You can even put in your insurance information. I want a female, I want a male, I want a Christian, I want a this, I want a that, and you can find a therapist on there. Here's some information for resources for older adults who are depressed. And again, you're going to get these slides, so I'm going through them quickly, but you're going to get these. Resources of caregivers of people with dementia. And then we also have put together a series of videos, and it's called Stress Less with James L. West. They are 30-minute videos where Jamie and I don't know how many are there, Jamie, probably 30, 25, 30 videos where we actually walk you through a stress reduction technique. And here is our information. Perfect, we're right on time. So let me open it up and see if there were any questions or comments.
Holly, I want to say that this was so informative because, you know, I mentioned to you that with all my stuff that I've been having, I never knew that there was a brain stress.
Yes, yes.
And that's kind of what all my doctors have concluded or are concluding. I still have one more neurological appointment, but all the releasing of and what you're calling it, and I know you're going to send us all this stuff, so hopefully that way I'll know the names of this is too much and this is not enough. And because they try to explain it to me, and it was like, because I personally, I mean, they've told me this before, you know, back when, and I just kind of thought, nah, you know, because I didn't feel anything.
Right.
And I still don't feel anything. I mean, other than my blood pressure, which I can see and feel and all that kind of stuff, anxiety, depression, those were two things that they're telling me, and I'm going, no, you know, I mean, I don't feel it. I don't have that. I mean, I don't have the heart palpitations. And it's because it's all brain related, not heart related, which
Yep.
I was not aware of all of that.
Mm-hmm.
But obviously, it's just been weeks since they've readjusted and gave me some medications for the releasing and not releasing or whatever.
Right.
And I feel so much better. And because my blood pressure is finally, like this last week, under control. I mean, I've started driving again, you know, so it's like I said, obviously that stuff is working. And I mean, I may not even need blood pressure medication because some of the antidepressant and the anxiety medication that they put me on that I was refusing for the longest time because I'm not depressed. I don't have anxiety,
I am glad you brought that up, Maria, because so many times we don't see it in ourselves. And that's where I also encourage you to be very honest with somebody that you trust and ask them if they are seeing something in you, because so many times we don't see it because it's become our normal. It has become our baseline, and we're not even seeing, like Maria said, we tend to think depression or stress and we think sad. Well, I'm not sad, so it must just be these other things going on. Let me get to a question I saw real quick.
Okay.
Can your body be in stress mode, carrying stress without you? Yeah, that's what we were just talking about. Absolutely. You cannot even be aware that this is what's going on and this is what's going on, especially right now, because think of what we have had to do in this last year. We're on autopilot. The majority of us have been running on autopilot now for over a year. What has it done to our health? And we're not even realizing it. That is why right now, I think as things are kind of starting, we're trying to kind of start coming out of this messy middle, we're going, wait, there is something going on. So yes. And then a definition of stress and anxiety. So anxiety, usually, not always. So let me do more like depression and anxiety. Depression many times is when we focus a lot on our past, things that have happened. Anxiety many times is when we're focusing on the future, what might happen, where we're getting caught up in the what ifs rather than the woulda, coulda, shouldas, if that makes sense. Very, very close. Treated real, most of the treatment is a pretty, now there's an antidepressant and an anti-anxiety meds. Antidepressants you tend to take a little longer term, anti-anxieties not so much. They may be situational again. It isn't something that we stay on long term. Typically, doctors most of the time will also try antidepressants first. They don't have near the side effects that an anti-anxiety does. Great questions. We are right at time. If anybody wants to stay on, I do want to respect your time. We're at 11:35. We appreciate you being on here. You will get these PowerPoints later today. You will also get the program. I encourage you to share those and to also make sure you go and check out that Stress Less with James L. West, at where we walk you through and talk you through different ways to take care of yourselves.
Thank you.
All right. Thank you, everybody. We appreciate you being on today.